the truth about due dates and how to manage your expectations around your estimated due window. Your due date is never set in stone. It's never a guarantee. Your due date is it's not an exact science. We can get pretty close to guesstimating that due window, and I'll share a little bit about the best ways that we can get as close as possible to it. But again, never is your due date, the date that your OB or your provider essentially gives you, is that going to be a guarantee. It's just going to be a time frame as to when we are all sort of guessing as to when baby will be born. The reason why we can never guarantee your actual due date is because there's so many factors that play into how we calculate getting your estimated due date. Using these tools to calculate your due date, it's just going to give us an approximation, because even with your last missed period and calculating based off your cycle, it can vary from person to person because everybody's body is different. We all have different cycle lengths, and those cycle lengths even change month to month. So it's never going to be just a 28-day cycle for anybody. It's always going to go off maybe a couple days or a day or two, using the term due date versus due month. And it's just something that you can do to help relieve some stress surrounding that time frame that baby is going to arrive. I often feel that using the term due date can sound like it's set in stone, like this is the date that baby's arriving, versus a due window or a due month gives you some more room there, some more wiggle room for us to give that estimation and maybe help with lowering your anxiety around when baby's going to arrive. I want to share a statistic with you, and I want you guys to make a note of this so that you can get a better picture as to how often babies are born on their due date that's originally given to them. About 5% of babies are actually born on their due date. And to give you an even better idea, normally first-time moms go into labor at about anywhere from 41 and 3 days and 41 and 5 days. So that just shows that, especially when having your first baby, it does take a little bit longer and you are most likely going to go past your due date. Talk a little bit about the role of anxiety and expectations when talking about this specific topic when it comes to your due dates. I want to acknowledge that it is totally normal to have anxiety and some fears and worry and a little bit of overthinking or over obsessing about when is baby going to arrive. It's super, super normal. So I just want you to know that you're not alone, and these feelings may arise and come up for you. Especially they may come up even more so when this is your first baby, right? This is the first time that you're ever experiencing this, and everything is so new and a little bit scary. So I totally understand. I'm here with you, and I just want you to know that it's okay. But this is why we're talking about this specific topic, because I want to hopefully give you more education, more knowledge, so that it helps with reducing that anxiety and those fears when it comes to when baby's arrival date will be. I also want to help you shift your mindset a little bit. And like I mentioned, instead of using the term due date as we just discussed, using more of a due window or due month, and even as far as going to use an anytime window. That term is also great. And the reason for this is because I want you guys to focus on just that window, that time, so that you can be better prepared, right? If we focus on just this one date, it's going to be harder for us to really get ready, get prepared, versus if we plan ahead and we say, well, baby can arrive anytime this month, then let's actually start preparing ahead of time. Let's prepare as much as we can for the labor, for after labor, for when baby is here. Let's just give us more time to be able to be prepared. And the more time you give yourself, then that again is going to reduce so much more of that anxiety that keeps coming up. Just preparing for the unpredictable. Birth, there's so much that can come up and change. We can plan everything for birth, right? Have everything ready. But at the end of it, we don't truly know how your birth is going to unfold. So I highly recommend, if you prepare for all the things, for all the possibilities, that your birth experience will overall be much less traumatic. And same thing when it comes to this due date and estimated due time, right? It's the same idea. I want to just encourage you all to dive deep into what this specific topic, what is coming up for you, what anxieties, what fears, and also so that you can start trusting the process more. I'm going to share some tips on how you can process any of these emotions that are coming up for you, and so that overall you can begin to trust the process, just sink into it and ground into it, and start to accept that this is the way. A few other things that I forgot to mention are just knowing that your body and baby will decide together. They're in sync as to when your body is ready. There's so many factors that play along with this, but a big part of it is going to be your baby and how and when they descend into the vaginal canal. I will dive deeper into this topic, but for now I just wanted to give you a little bit of that insight. Being flexible with this due time, this due month, this due window, staying flexible will help reduce stress significantly, and just being able to be more adaptable to whatever comes up, whatever date that your labor does start to unfold.